If you are living with sciatica, that deep, burning, shooting discomfort that travels from your lower back through your hip and down into your leg, and you also happen to deal with bloating, irregular digestion, frequent gas, food sensitivities, or a gut that never quite feels settled, I need you to stay with me for the next few minutes. What I am about to share will connect two things inside your body that you have almost certainly never considered to be related. And this connection is not a theory. It is not fringe medicine. It is grounded in peer-reviewed science, supported by a clear and well-documented biological mechanism, and confirmed by outcomes I have personally witnessed in patients who had exhausted every available option and were still in pain. Here is the question that reframes everything. What if the fire burning inside your sciatic nerve right now is not originating from your spine at all? What if it is coming from your gut? I understand how that sounds. I recognize it seems like the kind of claim that belongs outside serious medicine, but I ask you to remain open for just a few more minutes. Because for many people over 60 who have been managing their sciatica for months or even years without lasting relief, this is the missing piece. The piece no one ever looked for. The piece that changes everything once it is finally found. Your gut symptoms and your sciatica are not two unrelated problems occurring simultaneously by coincidence. For many people, they are two visible expressions of a single shared underlying problem. Chronic systemic inflammation being generated continuously inside the digestive system and traveling through the bloodstream directly to the most vulnerable nerve tissue in the body. I'm Dr. Thomas, and today I will show you exactly what is happening inside your digestive system that may be sustaining your sciatic nerve pain every single day, and precisely what you can begin doing about it right now. Let me start with the foundation of everything I'm going to share today, because without it, the rest will not carry the weight it deserves. Your body does not experience inflammation as a localized event. This is perhaps the single most important point I can make, and it is the area where the conventional sciatica treatment model is most fundamentally incomplete. When your doctor reviews your MRI and identifies a herniated disc or a narrowed spinal canal pressing on a nerve root, they see a local mechanical problem calling for a local mechanical solution. Reduce the local inflammation, decompress the affected nerve, strengthen the surrounding muscles. I want to be clear, those interventions carry genuine value. I am not dismissing them, but they rest on an assumption that your sciatica is a local problem. And for the majority of people with chronic recurring sciatica, particularly those over 60, that assumption is only partially correct. Your sciatica is not simply a local problem. It is a whole body problem expressing itself in one location. And the organ most responsible for generating the systemic inflammatory environment that makes your sciatic nerve vulnerable, reactive, and painful is not your spine. It is your gut. Let me explain the biology, because understanding this mechanism is what makes everything that follows feel not just logical, but necessary. Your gut houses approximately 38 trillion microorganisms, bacteria, fungi, viruses, and other microbes that together form what scientists call the gut microbiome. This microbiome is not a passive resident of your digestive system. It is an active, dynamic, and enormously influential regulator of your immune function and your body's entire inflammatory response. When your microbiome is healthy, when beneficial bacterial populations are strong and microbial diversity is high, it produces compounds called short-chain fatty acids that actively suppress inflammatory signaling throughout the entire body. It trains your immune system to respond proportionately to genuine threats. It maintains the integrity of your gut lining, that single-cell layer barrier separating the contents of your digestive tract from your bloodstream. In a healthy gut environment, your body exists in a fundamentally anti-inflammatory state. And in that state, your sciatic nerve, even when mildly compressed or irritated, has the biological resilience to tolerate that irritation without generating debilitating pain signals. But here is what happens when that balance breaks down. And I want to be direct with you. The modern lifestyle disrupts the gut microbiome almost universally. A single course of antibiotics taken years ago can shift microbial balance in ways that persist for months without deliberate restoration. Processed food and refined sugar feed harmful bacterial strains while starving beneficial ones. Chronic stress, the kind many of us carry quietly, elevates cortisol, which directly damages the gut lining and suppresses beneficial bacterial populations. And here is the one that consistently stops my patients. The non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, most commonly recommended for sciatica pain, are among the most gut-damaging pharmaceutical agents in regular use. This creates a devastating irony in which the medication prescribed for nerve pain is simultaneously worsening the gut inflammation that is driving that very nerve pain. When the gut microbiome is chronically disrupted, it stops producing anti-inflammatory compounds and begins releasing pro-inflammatory signals that enter the bloodstream and circulate to every tissue in the body, including the tissue surrounding your sciatic nerve. Now let me introduce the concept that ties everything together: intestinal permeability, or what you may have heard referred to as leaky gut. Under normal, healthy conditions, the gut lining functions as a remarkably selective barrier. It allows digested nutrients, water, and beneficial compounds to enter the bloodstream while keeping bacterial toxins, undigested particles, and harmful inflammatory substances contained within the digestive tract where they belong. But when the gut microbiome is chronically disrupted, the tight junctions between the cells of the gut lining begin to loosen. Microscopic gaps develop, and through those gaps, substances that should never reach the bloodstream begin leaking through. Among the most harmful of these is a compound called lipopolysaccharide, or LPS, produced by certain bacteria in the gut. LPS is one of the most potent inflammatory triggers known to science. When it leaks from a compromised gut lining into the bloodstream, it activates a whole-body inflammatory cascade that is entirely disproportionate to any structural problem in the spine. Your immune system responds as though the entire body is under threat. Inflammatory signals flood through the circulation, and the nerve tissue that is already most vulnerable, your inflamed, compressed, sensitized sciatic nerve, becomes the target of an inflammatory assault it cannot withstand. This is why your sciatica flares during periods of stress. This is why it worsens after a weekend of poor eating. This is why it responds so poorly to treatment when your digestive system is in distress. And this is why, for patients with significant gut dysfunction, even the most effective spinal treatments produce only temporary results, because the inflammatory supply line from the gut to the nerve continues running. Every time local inflammation is suppressed by treatment, the gut quietly replenishes it. Let me now walk you through the 5 specific ways gut dysfunction drives sciatica pain, because understanding each one gives you a concrete target to work on in your recovery. The first is LPS-driven systemic inflammation. Bacterial toxins leaking from a compromised gut lining create a whole-body inflammatory state that directly sensitizes the sciatic nerve and lowers its threshold for pain. Reducing gut permeability reduces LPS in the bloodstream. Reducing LPS reduces the inflammatory burden on the sciatic nerve, directly and measurably. The second is cytokine amplification. Your gut-associated immune tissue, which accounts for approximately 70% of your entire immune system, produces inflammatory messengers called cytokines in response to gut dysfunction. These same cytokines are found in elevated concentrations in the disc and nerve root tissue of chronic sciatica patients. Reducing gut inflammation lowers cytokine production, and reduced cytokine levels reduce disc and nerve inflammation. The pathway is direct, and the supporting evidence is substantial. The third is nutrient malabsorption. A chronically inflamed gut is an inefficient gut. Even when your diet is clean and your supplement routine is consistent, a damaged gut lining cannot absorb nutrients at full capacity. The vitamin D, magnesium, and B vitamins that your sciatic nerve depends on for structural integrity and self-repair may not be reaching your nerve tissue in adequate amounts. Not because you are not consuming enough, but because your gut is not absorbing what you are providing. Restoring gut health dramatically improves nutrient uptake and makes every other element of your recovery protocol more effective. The fourth mechanism is central sensitization, driven through the gut-brain nerve axis. Your gut and your nervous system are connected by the vagus nerve, a bidirectional communication pathway that researchers have only recently begun to fully understand. Gut inflammation sends distress signals through this axis that increase pain sensitivity across the entire nervous system. When your nervous system becomes centrally sensitized, it amplifies pain signals from the sciatic nerve far beyond what the structural situation alone would produce. Addressing gut inflammation literally reduces the volume of pain perception at a neurological level. The fifth is cortisol dysregulation. Chronic gut inflammation keeps the stress response system activated and cortisol levels persistently elevated. Elevated cortisol suppresses the immune system's ability to resolve inflammation, increases gut permeability further, degrades the connective tissue supporting your spinal structures, and significantly raises pain sensitivity. It becomes a self-reinforcing cycle. Gut inflammation raises cortisol. Elevated cortisol worsens gut inflammation. Worsened gut inflammation raises cortisol further. And with each revolution of that cycle, sciatic nerve pain intensifies. Now let me share the story of a patient I will call Barbara. Barbara was 64 years old, a retired school teacher when she first came to see me. She had lived with right-sided sciatica for 3 years. She had done everything correctly: physical therapy completed consistently, supplements taken daily, sleep position corrected, an anti-inflammatory diet largely followed, and daily walking without fail. And yet, her sciatica kept returning every 2 to 3 months, reliably. A flare lasting 3 to 4 weeks, then subsiding, only to return again on schedule. She could not understand why nothing was holding. She told me, "Dr. Thomas, I am doing everything I am supposed to be doing. My body is not responding the way it should. Something is missing, and I cannot identify what it is." When I sat with Barbara and took a truly thorough history, the kind that looks beyond the spine and considers the whole person, something surfaced that had never been addressed in any of her previous treatments. Barbara had a long history of digestive difficulties. Chronic bloating she had come to accept as simply part of her life. Significant food sensitivities to gluten, dairy, and several other foods that reliably caused discomfort and had developed over the previous 5 years. Irregular bowel habits. A history of multiple antibiotic courses over the prior decade for recurring urinary tract infections. And a diet that, while largely clean on paper, included several foods that were specifically problematic for her individual gut chemistry. She had mentioned these digestive issues to previous doctors. They had never been connected to her sciatica. They had been treated as a separate concern, or more precisely, they had not been treated at all. They had simply been accepted as normal. I referred Barbara for comprehensive gut microbiome testing. The results confirmed significant dysbiosis, a serious imbalance in her gut bacterial populations, along with elevated markers of intestinal permeability. We then implemented a targeted gut restoration protocol alongside her existing sciatica management. We removed her specific trigger foods completely for 90 days. We introduced a high-quality multi-strain probiotic to begin rebuilding microbial diversity. We added prebiotic foods to nourish beneficial bacterial populations. We incorporated glutamine, an amino acid that directly supports gut lining repair, alongside bone broth and other gut-healing nutrients. We addressed her cortisol dysregulation through structured sleep improvement and a simple daily stress reduction practice. And we added digestive enzymes to support nutrient absorption while the gut lining was healing. The improvement was not immediate. Gut restoration takes time. Progress is measured in weeks and months, not days. But by week 6, Barbara's digestive symptoms had reduced significantly. The chronic bloating she had normalized for years was largely resolved. By week 10, her energy had improved in a way she had not anticipated. A whole-body vitality she had forgotten was possible. And at the 4-month mark, She came into the office looking genuinely well, not managed well. Her sciatica had not flared once in the previous 2 months. The cycle that had governed her life for 3 years had simply stopped. She said, "I cannot believe the answer was in my gut the whole time. 3 years of treating my back, and nobody ever once looked at my digestion. Here is your complete gut sciatica healing protocol. Approach it with patience and consistency, because that is what it requires. Begin by identifying and removing your personal gut trigger foods for a minimum of 60 days. The most universally inflammatory foods are refined sugar, processed vegetable oils, gluten-containing grains, and alcohol. Eliminating these 4 categories alone produces measurable improvement in gut lining integrity within weeks for most people. Introduce a high-quality multi-strain probiotic daily containing multiple lactobacillus and bifidobacterium strains with a minimum of 10 billion colony-forming units per serving. Add prebiotic foods, garlic, onions, leeks, asparagus, green bananas, and oats to your daily diet to feed beneficial bacteria. Incorporate 5 grams of glutamine each morning on an empty stomach to directly support gut lining repair. Add 1 to 2 cups of bone broth daily for its collagen, glycine, and glutamine content, which specifically nourishes gut lining cells. Address your cortisol load by prioritizing sleep quality, adopting even a simple 10-minute daily stress reduction practice, and reducing the inflammatory habits that keep your stress response chronically activated. And give this protocol a minimum of 90 days, because meaningful gut microbiome restoration and gut lining repair does not happen in 2 weeks. It unfolds over months of consistent daily support. The connection between your gut and your sciatic nerve is not a theory. It is not alternative medicine. It is a well-documented biological reality that conventional sciatica treatment has simply not yet integrated into standard clinical practice. But you do not have to wait for that integration. You have the information today. You have the protocol today. And starting today, you can begin addressing the hidden inflammatory source that has been sustaining your sciatic nerve pain from within. While every treatment you have ever received has been attempting to extinguish the fire without locating where it begins, your gut is not separate from your sciatica. Your gut is part of your sciatica. And healing your gut may be one of the most meaningful things you ever do for your sciatic nerve. Barbara demonstrated that, and so can you. If this video gave you a new perspective today, please share it with someone you care about who is living with sciatica. Leave a comment below letting me know. Do you experience gut symptoms alongside your back or nerve pain? I read every comment from this community, and what you share genuinely helps me understand how to serve you better. Subscribe to this channel. Every week I bring you the kind of evidence-based health information that every person over 60 deserves access to. I'm Dr. Thomas. Take good care of yourself, and I will see you in the next video.